The liver is the largest internal organ in the body, excluding the skin. It performs more than 500 vital functions to maintain the body's physiological equilibrium. However, just like other organs, this powerful filter can also be prone to diseases, and among the most common is the excessive buildup of fat in the liver. While most people with fatty liver disease do not have any symptoms at all, it is important to know the early indications of this condition, especially for those who are at risk. In today's video, we'll look at the early warning symptoms of fatty liver disease that you should not ignore. These signs are very crucial to know because you can practically reverse the fatty liver condition if you detect it early on. So, what is a fatty liver disease? Before we discuss the symptoms, first, let's understand what fatty liver disease is and how it develops. The term fatty liver disease is an umbrella term that encompasses two types of conditions: alcoholic liver disease, ALD, and non-alcoholic fatty liver disease, NAFLD. As the name suggests, ALD occurs due to excessive alcohol consumption, whereas NAFLD is caused by factors other than alcohol, such as obesity, high cholesterol levels, and diabetes. As we said earlier, there are usually no visible symptoms of fatty liver disease, whether it's ALD or NAFLD, but some people may experience mild symptoms like fatigue and discomfort in the upper right side of the abdomen. However, if you have NASH and it progresses to cirrhosis, you may start experiencing more severe symptoms, which can even lead to liver failure. So, let's look at the early warning signs to catch the disease before it's too late. Itchy skin. While itching may seem like a minor symptom, it can be one of the earliest signs of fatty liver disease. As the liver becomes inflamed, it releases bile salts into the bloodstream, which can cause intense itching on the skin. This symptom is more common in individuals with NAFLD and can occur all over the body, including the face. Well, most people normally scratch when they feel itchy, but in the case of NAFLD, scratching may not provide relief and can worsen the irritation. If you experience unexplained itchiness, it's best to consult a doctor for proper diagnosis and treatment. Weight loss. Another possible early sign of fatty liver disease is sudden and unexplained weight loss. While it can also be a symptom of other conditions, like thyroid problems, cancer, or depression, if you have NAFLD, it's important to monitor your weight. The reason for this is that your liver plays a vital role in metabolizing fats and carbohydrates, and when it does not work well, the body will start using the stored fat for energy, leading to weight loss. It's essential to remember that if you're losing weight without any change in your diet or exercise routine, it could be a red flag for fatty liver disease. Yellowish skin and eyes. If you notice a yellowish tint in your skin or eyes, it can also be a sign that your liver is not functioning properly. This yellowish discoloration, also known as jaundice, occurs when there is too much bilirubin, a yellow pigment secreted by the liver, in the bloodstream. If a person has fatty liver disease, the inflamed liver cells may not be able to filter out bilirubin from the blood, which leads to its buildup and causes the yellowish color. While it can also be caused by other conditions, if you suddenly develop jaundice, you should go to the emergency room immediately. Shortness of breath. As the disease progresses, you may also experience breathing difficulties or a strong, musty smell in your breath. Breathing problems can occur due to the buildup of fluid in the belly, ascites, which can compress the lungs and make it hard to take deep breaths. In addition, the elevated levels of toxic substances in the bloodstream can cause a distinct odor in the breath, known as fetor hepaticus. This symptom is more common in advanced stages of fatty liver disease, and if left untreated, it can lead to more severe respiratory or cardiovascular issues, which can be life-threatening. Urine and stool changes. Another common sign of fatty liver disease includes changes in urine and stool color. If you have this condition, your urine may become dark in color, almost similar to the color of cola. This is because the liver is not functioning well and cannot filter out all waste products from the blood. As a result, bilirubin can build up in the urine, giving it a darker hue. Similarly, your stool may also turn pale or grayish, as the bilirubin is not being properly excreted through the digestive system. If you notice any significant changes in your urine or stool color, it's best to consult a doctor for further evaluation. Spider-like veins on the skin. If you have fatty liver disease, you may also start to notice small, spider-like veins on your skin. These web-like clusters of blood vessels, also known as spider angiomas or spider telangiectasia, are typically found on the face, neck, arms, and upper body. These lesions usually have a central red spot with reddish extensions that radiate outward like a spider's web. These spider-like veins are more common in individuals with liver cirrhosis and are painless. While other conditions like thyrotoxicosis, rheumatoid arthritis, and pregnancy may also cause spider angiomas, if you notice them along with other symptoms mentioned above, it's essential to get medical attention as soon as possible. Abnormal bleeding or bruising. The liver cells play a crucial role in the synthesis of the majority of blood coagulation factors, including fibrinogen, prothrombin, factors V, 7, IES, X, EVAMT, and thurine, as well as protein C and S. These factors are essential for the blood clotting process, which is vital for preventing excessive bleeding when injuries occur. However, conditions such as fatty liver can impair the liver's ability to produce these coagulation factors, leading to abnormal bleeding or bruising. This can include things like frequent nosebleeds, prolonged bleeding from cuts or wounds, and unexplained bruises on the skin. It is crucial to seek medical attention if you experience any of these symptoms, as it can be a sign of more serious fatty liver disease. Mental confusion or tiredness. A liver that is working poorly can also lead to mental impairment, which is often referred to as hepatic encephalopathy. This condition occurs when the liver fails to filter out toxins from the blood, leading to a buildup of ammonia and other harmful substances. As a result, you may experience symptoms like fatigue, confusion, forgetfulness, difficulty concentrating, and even personality changes. While these symptoms can be mild and temporary in the early stages, they can become more severe and persistent if not treated promptly. If you notice any sudden changes in your mental state or always feel tired even after getting enough rest, don't ignore it and consult a doctor to rule out any underlying liver problems. Breast enlargement in men. In men, fatty liver disease is responsible for larger than normal breasts due to excess estrogen production. This condition is known as gynecomastia and can be very uncomfortable and awkward for men. Estrogen is a hormone that is found in both men and women, but at different levels. When a man has excessive amounts of estrogen in his body, it can cause the breast glandular tissue to grow and become abnormally large. While this condition can also occur due to other reasons like hormonal imbalance or certain medications, fatty liver disease can be one of the underlying causes. It may not be a life-threatening symptom, but it can have a significant impact on a man's self-esteem and quality of life. Swelling in the legs, feet, or hands. As fatty liver disease progresses, it can cause fluid retention in the body, leading to swelling in the legs, feet, and hands. This swelling, also known as edema, occurs due to increased pressure in the veins and can be very uncomfortable. The excess fluid can accumulate in the tissues of these body parts, causing them to become puffy, stiff, and even painful. In addition to fatty liver disease, other conditions like heart failure, kidney disease, and certain medications can also cause edema. Therefore, if you experience any unexplained swelling in your limbs, it's essential to consult a doctor for proper diagnosis and treatment because early detection of fatty liver disease can prevent further complications. In reality, fatty liver disease, whether it's non-alcoholic or alcoholic, is a chronic condition that can progress slowly but silently. In the early stages, it may not cause any noticeable symptoms, making it challenging to diagnose. However, as the disease progresses and damages the liver cells, more specific signs and symptoms start to appear. The ones mentioned in this video are some of the most common indicators of fatty liver disease that should not be ignored. If you experience any of these symptoms, we strongly recommend seeking medical attention for proper diagnosis and treatment, as early detection can help prevent further liver damage and improve your overall health. We hope this video has shed light on the importance of recognizing the subtle cues of fatty liver disease. If you found this video useful, please make sure to hit the like button and subscribe to our channel for more such informative videos. Until next time, take care and stay healthy.